to coming to our office?
The main problem I had was back issues that I had about for 4.5 years, and then I would get hot and cold flashes, and I would have no energy, and I couldn't do anything, like live my life the way I wanted it to. I felt like something else was living my life. I had pain everywhere, sensitivity to many foods, digestive problems.
Now the pain, how bad were these pains? 0 to 10, 10 being the worst.
Most of the time it would be between a 9 and 10. I couldn't sometimes get out of bed, go to work. I'm a teacher, so it's really hard to. The kids, obviously get affected by that if I can't go to work. I just couldn't live my life any way I wanted it to.
Okay. And then how about digestion issues?
Digestion issues, it doesn't matter what I ate. Even if it was vegetables, I was sick. I was on the toilet the whole time. I was just miserable. Sick. I would say I got sick. I had a lot of cold and stuff, and then since I've gotten better, I haven't been sick. I haven't even had a cough or a cold or anything.
Now, did you have to take a lot of days off work before?
Yes.
As a result of your condition?
Even more than I was supposed to. But then I had no choice. I couldn't even move to the point where I had to go.
Okay. So what type of doctors have you been to? Tell me all the different therapies you tried to try to get better.
I've done physical therapy. I've done steroid shots. I went to surgeons to see if I can get surgery done. I've been to
chiropractors?
Decompression, lots of different chiropractors, probably 20 different chiropractors, alternative ones that just did, hey, let's manipulate you this way, or, and I was always so painful by the time I left. I was probably crying most of the time.
Instead of feeling better, you felt worse.
Yes.
And you had cold laser.
I had the cold laser done.
You did everything. You had massage.
Yes.
You tried all the different therapy, and none of them worked.
Nothing worked.
And was your condition getting worse over time?
It was getting worse, and even after I would leave a doctor's appointment, even from them poking and prodding at me, I would get worse from just that.
How long did you struggle with all that?
About 4.5 years.
4.5 years, okay. And so since starting without treatment, tell me how soon before you started noticing change? And just kind of talk about how the treatment went. Initially it was kind of a challenge.
Initially it was really challenging because we started on the food diet, and my glucose started dropping, and so I was having more problems. And then after we started adding some foods back, I started feeling so good. I could start moving, and I could start feeling less pain. I lost 45 to 50 pounds within 3 weeks.
Wow.
It was amazing. I felt less pressure off my knees and stuff. It was absolutely phenomenal.
How about the adjustments? Did that help you with pain?
Yes, the adjustments. I would obviously look so forward to coming in here each week, twice a week, because I was like, okay, I get to feel better.
Yeah. From 9, 10 pain, severe pain, people can't even touch you pain.
Right.
To now, you're feeling no pain.
Yeah, 0.
And sometimes the pain relief was instantaneous right after the adjustment, wasn't it?
And I was even taking pain pills where cancer patients even have. It's like a morphine pill, and that's the highest pill they can actually give you.
And it didn't help.
It never helped.
And now you have no pain.
And I have no pain. I'm not on medications. It's not running my life.
And your digestion is better.
Digestion's better.
Okay. And so what do you feel like is the biggest difference between our approach and other doctors' approach? What do you feel like made the biggest difference?
I think the biggest difference is someone's actually caring about about my recovery. I felt like they had to do a steroid shot in order to go to the next step, and they had to do in order to get an MRI, they had to do an X-ray. But Dr. Khan and his associates group, I guess, fit a plan according to me rather than, one plan fits all, not for everybody. And I was a little bit difficult patient just because I had a lot going on.
No, you're special.
So I have my life back. I honestly can't say that enough. I'm only 23 years old, and I've had this probably since I was 18, and I felt like everyone's like, oh, the 20s are your prime area and you're supposed to live your life. I never got to do that. And now I can actually start, and I'm excited about that because I never got that, and everyone talks about it.
You know, what does your family and friends say about the changes that they saw in you?
Especially my mom. She's took care of me because I was bedridden for several months. So she took care of me, and she sees the biggest change, I think, from day to day, where I can actually move now, like where the point where she actually had to help me go to the bathroom or go to get a drink. She had to do that for me. And now to the point where I'm doing everything all on my own, and it's amazing.
And your family members, everybody sees the
Everyone
change.
sees change. Like even my associates at work, like they say that I'm in a better mood now, and you know, I'm happier, and I really am.
That's great. Awesome. Thank you so much for sharing.
Thank you, Dr. Cobb.